Good morning. My name is Darshan.
And I'm Panchali.
Good morning, myself Mayuri.
So we're here today in this wonderful physiotherapy unit. I see you've got us a model lined up. What is his problem?
First of all, welcome to our department. He's Mr. Pawan. He's a basketball player, and last week he got an injury in his direct injury in his shoulder, and I'm going to treat him with the ultrasound. And though it's an acute case, I'm going to treat him with the ultrasound for 6 minutes. So this is the ultrasound machine.
So shall we begin?
Yeah.
So just walk us through the process, doctor.
Okay. So first of all, I have to assess him. I have to take the basic assessment what we have, and yeah. So he got an injury over here. It's just a mild injury. I'm going to treat him with ultrasound. I have done all my assessments, basic assessments for him, and I'll start with my treatment. This is called as a treatment head. Before applying to the patient's skin, we have to apply a gel. This treatment takes only 6 minutes, and this is usually we used to treat this patient for the localized pain. So he is having only in the anterior shoulder, only in the one spot he is having a pain. That's it.
How long do you treat it for?
It takes only 6 minutes.
Okay.
But over a long period of time, is there repetitive sessions?
Yeah, he has to take this treatment for next 5 days, and then once the pain subsided, we will be asking him to come for once in a week or twice a week, and at the end of 5 days, we will be giving him some exercises, home programs. So he has to continue the home programs continuously.
And that is all that he has.
And also we used to advise him what are the do's and don'ts.
Right.
And along with that, he has to continue the home programs as well.
Okay. Would he be able to still play with his injuries? Or?
Yeah, he can.
Okay.
He can. But if the pain is there, he should avoid it, because once if he plays along with the pain will get aggravates and it leads to some other injuries as well.
Okay. So while you're doing this, I'll ask you some questions about what you all do here as a clinic and a training facility.
Yeah. Sure.
So what do you all provide for those who come here? What facilities do you all offer?
Basically, we are getting more ortho and neuro patients.
Right.
Ortho patients like fractures and injuries and sprains and conditions, and neuro patients we are getting the conditions like Parkinson's, stroke patients, and we are getting more stroke patients. Nearly we are having 2-3 stroke patients.
Okay.
So, and even one pediatric case, and those are the patients we mostly get here.
And what areas do you all train your students here?
We are training them in all the fields.
Okay.
That means all the departments, ortho, physio, cardio, and our students in their final year, they are going to the hospital placement. They are getting an hospital exposure, but from second year they are getting our clinical exposure here. Once they study all the modalities module, they can treat the patients. So when we handle the patients, they will be observing in their first year, and in second year they can individually treat the patients.
Doctor, now that the treatment's done,
Yeah.
often we see, doctor, that there are many patients who have the concept that physiotherapy is mainly about massage and other type of things. So is it true that it's all just massage?
It's not absolutely, it's not true. It's not only a massage. Everyone focuses, like if they say physiotherapy both, they will say it's a massage. No, it's not. Massages, it's what we also do massage, but it's only one part of it. Okay, for us it's only one part, massage. But massage is something different. Physiotherapy is something different. Physiotherapy is mainly we focus on the rehabilitation focus. It's like prevention as well as the treatment. Massage is only one part of it. Even we do massage for the specific conditions. So it's not overall massage is physiotherapy. Okay, that concept is totally different.
coming back to after this session, doctor, you would see that many patients have the concept that there is a lot of pain involved because they are coming with pain to you and you're gonna push and press a place. So what does the doctor have to say about that? Because pain is a very relevant thing to the patients when they come to a hospital.
Basically, we won't push or pull them. We will be following the certain procedures earlier for the specific conditions. The treatment we will be giving differs for each and every patient. So there is nothing push and pull. We will be following if the patient is coming with a pain, we won't be giving any exercises to the patient for 3 or 5 days. We will be first focusing on their pain. To subside the pain, we will be giving them any heat modalities or any other therapy we will be giving them to subside their pain. Once we subsided the pain, then we will be giving them exercises. The proper appropriate exercises we will be giving. Because once if we start the exercises with the pain definitely will aggravate, and we never follow it. Maybe one of the physiotherapists may follow a wrong procedure. So that's a fake thing. We never make a patient a worse condition.
Right. So let's talk about your training program you all have for the students. How do you all initially start off and how do you all develop it throughout the time?
Our students in first year, they will be learning all the basic subjects, example like anatomy, physiology, and from their first year they will be observing in our clinic the patients along with us. While we are treating, they will be with us and they will be in observation. And in second year, we will once they complete their modalities subjects, all the other modules, we can treat them individually. And final year, they are going for the outside placements like 2-3 hospitals and the center old age care and the pediatric centers, so they will get exposure in those departments as well.
Right. And people who have trained here, who are now outside, what kind of jobs have they gotten into?
From our institute,
right,
the students has gone to UK as well as US. In UK, Panchali University, once they complete your diploma in physiotherapy, they are following their advance in physiotherapy in Coventry University as well as in US mechanical. So from our college, most of the students are following their master's program in US and UK, and they can be a physiotherapist and in different specialization like sports physio, biomechanics, hand rehabilitation, according to what they choose their specialty.
Right.
So finally, doctor, before we end today, doctor, so one of the things that most people would like to know is, so we've done physiotherapy and we've come and learned, but what happens after that? Because we see today we have a plethora of doctors everywhere. So how can we ensure that we actually have a job or some form of placement after finishing the course?
Physiotherapy is one of the upcoming field all over the world. If you take abroad like European countries, everyone prefers physiotherapy nowadays. Once the patient has undergone surgery, the next thing the doctor prefers is the physiotherapy. So I can assure all the physiotherapists completed their graduation and then definitely they will get a job, either in the clinical side or a lecturing side, both. Nowadays everything is good, especially our sports physiotherapy is the most wanted specialization in our field.
Thank you.
Thank you so much, doctor.
Thank you so much.
Thank you for your time.